I can't get so many hours of sleep.
Young generation is among the worst slept in history.
Professor Dean Ho is the global leader in digital medicine, spending his career to save cancer patients by building AI software platform like Curate AI.
Now, he is turning science toward the biggest challenge of all, human longevity.
Thank you so much for having me on PMX Health. It's an amazing vision. It's such a pleasure to meet everybody. India is one of the most special longevity ecosystems in the world, including the amazing work you and your team are doing. And this is just the beginning.
When we talk about longevity, people think most of them lead monk life.
When we live with too much rigidity, we can run ourselves into the ground.
What you have been doing in the space of human trials.
I am my own test subject. So the work that we did was to develop algorithms that could change people's doses over time. I don't think at present there's a magic pill to solve sleep, magic pill to solve fitness, magic pill to solve food. But I do think there are magic.
My first question, or it's not a question, it's just from your experience, the Delta study that you have done. For those about your work for the first time, can you simplify what you have been doing in the space of health span, longevity, and human trials, just for the audience?
First of all, thank you so much for having me. Congratulations on PMX Health. It's an amazing team. It's an amazing vision. It's such a pleasure to meet everybody. The Delta trial was built off of a principle that we believe in deeply in our team, which is that we should be viewed as stories and not snapshots. I think we can all relate to traditional healthcare where patients will come in for maybe once a year. They'll look at some markers which are very conventionally selected. They'll be told how to maybe live a little bit better, maybe sleep better, eat better, exercise a little bit more. And then they don't engage with their own data for another year at least. And so that approach treats the participant, the patient, as a snapshot. But the real challenge is we evolve over time. The best dose for somebody on a Monday can be very different for that same person the following Monday. It can even change within a few hours. And so the work that we did was to develop algorithms that could change people's doses over time so that their treatment could evolve alongside them. We could also develop algorithms to pick better combination regimens, combinations of medicine, combinations of supplements, etc. And I think that we were starting to make progress, but beyond helping patients get better, we wanted to help keep healthy people healthy, or to make them even healthier. And one way to do this was for me to live my own experience of using our algorithms and to maybe re-engineer and recalibrate my own health. And that's the Delta study. It was a study that was deeply meaningful. I am my own test subject. It is ethics board approved. And I think as people can see, I certainly underwent substantial physical change. But I think the biggest insight wasn't that I could become much more muscular or much more fit, which was great. But it was for me the insight that being able to see my own data, being able to frequently see my efforts pay off allowed me to stick with the regimens that were developed. Because in the end, if we want that health span and we want the ability to make more memories with our friends and family, which to us could be so important for what truly living means, we need to stick with what we undertake. And that's what Delta taught me and hopefully can teach a lot more other people.
That's powerful. And you have been talking about the challenges as well while you were part of this study. What were some of the most challenging changes you had to make socially, more importantly, mentally, and then habit-wise as well?
Great question. I would say probably the most profound change for Delta was my sleep. I think many people can relate. I used to sleep at midnight, 1 a.m. I would try to wake up at 7 a.m. or 8 a.m. just to try and make up for it. And the reality was, and I wore many wearables during this study, was that my sleep was fragmented. It was constantly interrupted, and it was nowhere near the length that I thought it would be. And what I did was I moved my sleep from 1 a.m. to 9 p.m. overnight. And I will tell you, it was brutal, right? I woke up at 1 in the morning, 2 in the morning, and I thought to myself, is this really feasible? And so I stuck with it. And I don't recommend people having to take such drastic measures, but I do feel like this substantial chronotype change led me to where I am now, which is I average well into the 7 hours, 45 minutes or more, validated by multiple wearables. My deep sleep went up substantially. My restorative sleep as a whole went up. And I definitely feel and perform better, but it was a challenge, which leads you to the main question of the social challenges. I think we all value time with our friends. I think we value time with our family. And I would say, first off, I chose the 9 p.m. time because that's when my kids sleep. We are our kids, and our kids are us, are what we do. And when we live better, we pave the way for them to live better, because healthier parents have healthier kids, healthier doctors have healthier patients, healthier leaders have healthier team members. So how do we balance that with keeping those friendships? I have a group of friends in Singapore who are legendary friends. And my rule with them is when we hang out, there's no rules, right? We will hang out, watch reality TV. It can go late into the evening because that's what friends are for. And when I'm on kind of my standard regimen days, I'll get to sleep at 9. We'll get to this, I'm sure, when we talk about the eating regimen, but when we're out with friends and we maybe are outside of our standard eating window, being with the friends, making the memories is the priority. Exactly. Totally agree. So I think that there's a balance. There's always a balance to be had. We just don't have to tilt completely in either direction. That's what keeps us not just physically healthy, but mentally healthy as well.
The sense of purpose that you're talking about, why balance is needed, why sometimes overdoing may come back negatively at us, is very, very crucial. Most of the people do come with this question when they want to feel better, get better, optimize themselves, and they have to start working with optimizing their sleep. Then this is the most common question. Oh, but my bunch of friends, we all hang out together, they have different schedules. Oh, that might not be possible. I can't get so many hours of sleep. Then this is the same thing we talk about. Find a balance. If it's 5 days for yourself, if it's 6 days for yourself, then that is that one day for your family or the friends, right? That's the entire purpose of human living.
That's right.
Yeah,
That's right.
true that. And also from your own study, were there things that you believed they would work, but surprisingly didn't?
Yes. I think that this alludes to what you just mentioned, which is balance. I think that I was able to find certain regimens. I had a fasting regimen. I still have a fasting regimen, which generally speaking is about 20 hours a day. So it's like a dosed fast of about 20 hours, and I eat during 4 hours. And we want to make things easy for people. I want to make things easy for myself. And so I started off with a fairly fixed regimen, eating between 11 a.m. to 3 p.m. I would exercise in the morning, sleep by 9. It was a comprehensive workflow, but I did find that while I would go through periods of time feeling great, that when we live with too much rigidity, while we might think that's optimum, we can run ourselves into the ground, and performance can suffer. We can get irritable, which we don't want to be. That's not part of living well, and certainly for the people around us also. Which then, when I sat in my chair and I thought about it, aligned totally with the concept of us being stories and not snapshots, but the stories evolve. And I started realizing that I think I need to start modulating a little bit more and adjusting, where you don't have to have this 20-hour fast when some days you need 16, some days you need 18, some days you don't need to fast. In that, when we can trust how we feel as one of those markers, that can be a very powerful driver of how we tailor these regimens for ourselves. I think there's this preconception or thought that optimization is a very clear approach that you can put on a piece of paper and stick with that and you'll be good to go. But we're always changing. We're always changing, and the regimens we undertake need to change with us. And that opened up a whole new door for Delta, which is, let's make myself the story. Let's make sure I practice what I preach. Dig a little bit deeper on how to adjust. We don't always have to go for that high dose. We know about ego lifting. We don't want to ego fast either. Not good for us. Don't want to do that.
That's a fantastic revelation, because we have different sets of individuals and clients. Some want to be optimized. For some, optimization doesn't matter. They just have top two symptoms that they just want to deal with. Longevity is far of a game for them. And there are certain set of individuals as well who want to stick by this very rigid plan, like, oh, this is my fasting window, etc. And modulating it and evolving it according to your behavior and as per you feel from the morning you wake up till you sleep defines what is optimal for each individual, I think.
You're absolutely right. I think that we all know we're different from each other. That's the basis of precision and personalization. But we are different from ourselves over time. And I think we, at the heart of it, need to be kinder to ourselves when we live the regimens we hope will help us. And when we're too hard on ourselves based off of some kind of self-created or methodically created way of living, it doesn't become fun. It doesn't become healthy. It can actually have negative impact. And so with the numbers that we're now able to get that quantify our health, with the technologies that we have, at the heart of it, we have to trust ourselves, be kind to ourselves, so that we have the humility to adjust what optimum means, what the regimen looks like, because that's what health span is.
That's a very nice way to put it, I think. Were there any interventions or practices over the course of time, since you were evolving, you have been adapting your own protocol? Were there interventions that you left? I mean, apart from fasting protocol, that rigid fasting protocol. Yes.
One of them was my high intensity interval training regimen. VO2 max is very popular right now, and it is an important marker. I get a little bit worried that people are going to hurt themselves trying to seek a VO2 max that will be not needed for them and potentially not achievable, which is still okay, by the way. And so what I did was I undertook a protocol where I was doing 4-minute sprint, 3 to 4 minute walk, 4 cycles, which is quite common. And I found that to really help with my VO2 max, I felt that it was making me certainly feel healthier, but there was no way that it was sustainable. There's just no way. I was going to injure myself. I think that was something where I still do the regimen. I don't do it nearly as frequently. And then I realized, if I do this for 3 months, 6 months, and then I never do it again because it was so painful, then it's just a short-term win. What type of interval training can I do that I actually will enjoy? That's not a recipe to be followed with the sacrifice of stickiness, of being able to adhere. And that led me to all kinds of regimens that I was working on that I have fun with. Some days I'll do 1 minute run, 1 minute walk, alternate. because that's actually easier for me. Some days I'll do a 2-minute run, 2-minute walk. And that's not that traditional protocol, but these are way more sticky for me. And I'm actually much happier now. I actually look forward to interval training, knowing that I don't have to follow a very specific and very proven approach, but it's one that I'm still doing to this day because I like it better.
Yes. I think consistency matters. It's okay if you're not giving 100% every single day, but you're always upwards trending and not very rigid with your protocol and not sort of sacrificing for those strict protocols also is very important.
You're totally right. The best regimens are the ones we want to do, not the ones we have to do or conform to because everybody is doing it. And again, whether it's fitness, food, fasting, it's the ones that we can self-initiate, do so in a healthy and constructive manner, and have the enthusiasm to get up and want to walk into. That's what keeps us adhering.
Yes. And enjoy doing.
That's right.
Yes. I think most of them would be excited to know what your day would look like.
Yeah, it's a great question. It's a great question. And while I'm like much kinder to myself now, I do follow kind of a general framework so that we don't have these kind of magic pill concepts, right? I don't think at present there's a magic pill to solve sleep, magic pill to solve fitness, magic pill to solve food. But I do think there are magic micro adjustments. And that's what my daily regimen represents as a whole. So I wake up at 6 a.m. every day. And the reason I pick that time is so that I have ample time to get ready and then send my kids to the bus. I love seeing them off to school ever since they were 4 and 5 years old, approximately. Now they're 11 and 13. And so even though it's only a few minutes to do it, it's something that's very valuable to me. So 6 a.m. I wake up. People might be surprised to know that I take coffee and I finish my last drop of coffee for the day before 7 a.m. because their bus shows up at about 6:50 something. And I know there's a lot of discussion about when we should take our coffee, and I think it's very individualized. For people who are kind of very, active, etc., I think maybe for some of us, we can worry a little bit less about the cortisol, etc. But last coffee before 7 a.m. I'm in the gym also by then. I'm usually in the gym just before 7 because I put them on the bus, go to the gym, which is in my unit, and I'm working out for about 90 minutes, which is comprised of some sort of strength training, some sort of maybe zone 2 or a short interval circuit, and then some stretching. And then after that, get ready for work. I've very recently been into just getting my steps in by taking public transportation, which I really enjoy. I've come to super enjoy it. And then I get to work and it's like 25 minutes door to door, sometimes even faster to do public transport. And I get the steps in. I do walk up the stairs in my building. It's not a huge walk, but it's about 5 stories up. And I get to work, enjoy hanging out with my colleagues. And my feeding window is around now. It'll fluctuate 11 to 3, 12 to 4, maybe even a little bit longer, 12 to 5, 12 to 6. I do try to complete my eating before 6 p.m. because I'm sleeping by 9. And the evening time I cherish. It's time that I might watch some TV shows with the kids. One thing I want to note is they do eat dinner, they're kids. And when they eat, we hang out with them at the table, no devices, and we talk about our day. We're very present. Even though I may not always be eating dinners, we don't let our kids do intermittent fasting, but we do hang out with them, and we want to make sure that we spend that family time. We have a relatively minor wind down process. We don't have all the lights out in the house or anything like that, but we do kind of chill out a little bit. And then before we get to sleep, we say our goodnights, and I'm down by about 9 o'clock. and I'm probably asleep by about 9:20, 9:30 at the latest. So I'm aiming for over 8 hours a day. I think it ends up at about high sevens, low 8 hours.
Fantastic. When we talk about longevity and protocols, people think most of them lead monk life. But from what we hear, it's not very difficult to do so. Most of the times, our days, always recalling what you're talking, and I'm thinking, okay, what I'm doing during that time of the day. Most of the time, my day goes in the same manner as well. Same age children, maybe. Coming back to work again from the Delta study, your personal life, I see that you have traveled to India 5 to 6 times in the last year. And I also hope you got to meet a lot of health tech startups in India. I want to hear from your POE, point of view. How has health tech ecosystem been evolving in the last 1 year?
India is one of the most special longevity health span tech ecosystems in the world, including the amazing work you and your team are doing. I think that the ecosystem in India is built on tradition, on culture, on tech, on innovation, and on accessibility. And it begins with so many different pillars that are amazing, from food, from structured fasting, which is embedded in many parts of the society here, to breath work, meditation. And then when we talk about innovation, some of the best innovation in the world. I've met doctors who are in the earliest stages of their career getting priority reviews for some of the devices that they're developing with regulators that are going to make it into the clinic and will change practice. The work you are doing has helped so many patients, and it's built upon this comprehensive, also patient-included process, which gets back to the heart of what keeping people healthy was always about. I think one of the coolest parts about being in India is the principles of nutrition. And I think we can all agree that nutrition is a critical pillar to keeping healthy people healthy. And we also know that nobody's fault that nutrition is not part of conventional medical training on a worldwide scale. And I think that being in India, when I feel the energy, and that's real, and I feel the culture, which I love. I feel the amazing drive and enthusiasm to take an idea, to interact with the end users of the idea, which could be many people, many stakeholders, and that drive to get this innovation to people as quickly as possible. All of these together makes where we are now one of the most amazing places on the planet. And I've been here many times in the last 2 years. And a big reason for that is the people. It's the people, it's the culture, it's the energy, and it's the conversion, the demonstrated conversion of people being helped. Again, much like what you've done for the past long while, which is amazing, and to the team's credit as well. It's a real team effort. And what's great about all of this is I've come to learn during the past few years of living in Asia that the world is tiny, truly small. And my ability to be here right now, and the number of times we've interacted and exchanged ideas over the past couple of years, it's critical for us to build that community, to expand that community, and to put our ideas to practice with people across different cultures. And that's what makes this part of the world so exciting to be a part of. And this is just the beginning. There's so much more we're going to do together. It's just the beginning.
Thank you for that. We are looking forward to it as well. Then I think we had such a beautiful discussion, amazing discussion, great conversation, great questions. So I like same answers as well. We are happy, we are excited, we look forward to having more conversations like this going forward, not just at PMX, at different stages out there, both India and abroad as well. Looking forward. Thank you. Thank you for coming.
Thank you for having me, and congratulations to you and the whole team for amazing work. Thanks, everybody.